So today we're doing a Clarifix procedure on a woman who has had chronic nasal drainage. She's young, so we thought she might have some allergies causing it, but in fact her allergy testing was only positive to dust mites, and she has had nasal drainage all year, inside and out, for many years. She's really failed to get any better with our normal array of nasal steroids, nasal antihistamines, and oral antihistamines. And so she has a condition that we call chronic non-allergic rhinitis. We've already gone through the process of getting the inside of her nose really numb and caused very little pain. She's been very comfortable the entire time. She's only taken one little pain pill, so she's very awakened with it. I'll go ahead and show you the inside of her nose. This is her left side. And here's the front of the nose with the septum here, the lower turbinate here. What we're going to do is use an instrument called the Clarifix to go back and freeze a spot right back here in the back of her nose where a nerve comes in right here that causes the lining of the nose to make too much mucus. We call that the posterior nasal nerve, and it brings in special fibers called parasympathetic nerve fibers to the inside of the nose. Those are the ones that cause that drainage. Here's her right side. She's got a deviated septum to the right here, but it's numb and she doesn't feel anything. And again, here, back in the back of her nose, right here's the spot that we're going to freeze with the device to get the nerve on the right side. The process of making her numb took about 20 minutes, and we've been taking our time because we're having a lot of fun. And now I'm going to do the first procedure on her left side, and you can watch what it does to the inside of the nose. This is the second generation Clarifix device. It's made by the Stryker company. The tip of the paddle allows cold liquid nitrogen to generate a very cold temperature, cold enough to freeze the surface of the lining of the nose. So we're going to introduce this onto the left side. Since she's numb, easily, very easily, get it back into the place where we want it to activate. Okay, are you feeling any pain with this? Good. So it's right now, right where we want it to get to that nerve. We're going to activate it for 30 seconds. Ready, Larry? Mm-hmm. On. She breathes, you can see the kind of the mist coming off of it. You're feeling no pain. If you get a little ice cream kind of headache, that's normal. That won't last for very long. You can already see the device freezing inside the back of the nose.
2, 1.
Great. So that's 30 seconds on. Now, will you just keep breathing through your nose? Nice. And the warm air of her breathing thaws the device so that we don't rip any of the lining upon removal of the device. And once we get to about 45 seconds to a minute, the device won't be sticky in there anymore. Doing super. And it's just about freed up. 2. There you go. Now upon removal, you can see nice change in the lining of the nose. That's right where the nerve comes out. And that's it on the left side. Right, so that's it. We finished both sides. The procedure itself took about 40 minutes total. And just to show you, there's no bleeding, minimal swelling at all. There's the site on the left that's been treated. Normal looking structures otherwise. And here's the site on the right. I'm not sure if it comes across on the video, but that site's a little bit blanched out, a little bit white now, and that's going to hopefully decrease that parasympathetic flow and turn into a dryer nose that doesn't run all the time. So that's truly the end of the procedure. We're going to let her wake up and get home, let the healing begin. Thanks.